Great. Welcome to those who are just joining. Thank you again for being here. There will be more people to join, but it looks like we have about almost 50 people. Half the people who have registered for the call are on. So we will go ahead and get started and others will continue to join us. But again, thank you for being here. So great to see so many familiar faces, new faces. I just wanted to welcome everyone for joining us at the International Rescue Committee in Salt Lake City's virtual town hall today. My name is Jesse Sheets. I work as the development manager here at the IRC. We're grateful for the opportunity to connect with you all. This week marked our 1-year anniversary in the pandemic, as our office closed in response to the spread of the virus and the earthquake we all experienced on March 18, 2020. Before we get started, I did want to take a brief moment to address a few housekeeping notes. First, please note we are recording this call and we'll send out a link to the recording in the coming days. Please feel free to share that link with your network or others who might want to learn more about the IRC, or for those who aren't able to join today. Next, due to the number of participants, we're going to keep everyone on mute to ensure speakers are not interrupted. However, please feel free to join in the chat, join in the conversation, add your comments, questions, and we'll work on addressing those at the end. So at the end of the presentation, we will open up for conversation and Q&A. We did receive a handful of questions ahead of the call that we'll be addressing, and then others that pop up in the chat throughout. But thank you for joining us. Today, we're going to be taking the next 45 minutes or so to hear from members of our leadership team in Salt Lake City, including Natalie El-Deiry, Executive Director, Carine Foly, Resettlement Manager, and Pamela Silberman, Health Program Manager. Before I share the presentation we prepared, I did want to take a brief moment for each of our speakers to introduce themselves. I think we'll start with Natalie.
Hello, everyone. My name is Natalie El-Deiry. I'm the Executive Director for the IRC in Salt Lake City, and I support our operations in Missoula, Montana as well. I've been with the IRC for 10 years and have had the privilege of serving as the Executive Director for almost 2 years now.
Great, thanks, Natalie. I think we'll go over to Carine.
So I'm Carine Foly. I'm the Resettlement Manager. I have been with the IRC for about 13 years, and I oversee our casework and housing and logistics teams.
Great, thanks, Carine. Okay. And then Pamela.
Hi, everyone. Thanks for coming today. Pamela Silberman. I'm the Health Program Manager here in Salt Lake City, and I've been with IRC for about 4.5 years. And I oversee all of our programs that work to support client health and well-being.
Great, thank you all. So I'm just going to go ahead and share my screen and then hand the time over to Natalie to get us started.
Thanks so much for taking the time out of your busy days to join us. I wanted to start today's town hall by acknowledging the senseless violence against Asian and Asian American community members in the aftermath of the attacks in Atlanta. As the IRC has robust operations in Atlanta that serve refugee and immigrants, I felt it was important to acknowledge these killings and the many racist and violent incidents that have preceded this attack that are causing deep fear within Asian American and Pacific Islander communities. We know that these attacks have increased as a result of the pandemic and xenophobic and nativist comments expressed that have risen over the past 4 years. And just to let you all know that at the IRC, we are monitoring the impact of these attacks in our local communities with our staff and with our clients. And we're committed to offering our support when needed and when asked and when appropriate, as the IRC is currently doing for the community in Atlanta. So thanks for allowing me a moment to do that. So today we're here to talk about our operations in Salt Lake City and what we've been able to accomplish thanks to the great support of so many of the people on this call and the larger community. We're pleased to share with you our annual impact report that was released in January. You all received it most likely in your emails or via other communication channels. But the impact report is designed to accompany IRC's annual report, which reflects our work globally. And this is an effort to contextualize our work locally. Despite the challenges we've experienced due to the pandemic over the year, in this last fiscal year, our staff of over 85 people and hundreds of volunteers who have been able to serve over 2,000 refugees and immigrants. The impact report details the work that is made possible through our over 20 programs that are divided into different sectors, including resettlement, economic well-being, health, immigration, and education. While we were only able to resettle 185 individuals, which is a stark decrease from years past, it's clear that our programs work with refugees beyond their initial resettlement period to assist with health education, small business development, home ownership, applying for citizenship, and so much more. So the report doesn't fully represent our ongoing COVID response efforts. The report is reflective of our last federal fiscal year, which is the year that the IRC operates on. However, it does illustrate how our work has sustained and even deepened in areas where we were able to provide support to the community. In our COVID response efforts, we provided over $80,000 in emergency housing assistance to support with rent and utilities. This is quadruple our historic annual emergency assistance that we provided in years past. In food security, our Spice Kitchen Incubator program has provided over 9,000 warm prepared meals to community members, both refugees, immigrants, and others through the Nourish to Flourish program. And in New Roots, we've distributed more than 500 food boxes that are filled with fresh produce, healthy staples, and other culturally appropriate foods. And to date, this has totaled over 36,000 pounds of fresh produce, dry goods, and halal meats. So we'll continue, those are just a few of the highlights. There's numerous others in terms of what we've done in our COVID response, but we are planning to continue our pandemic response into the coming year. As we know, recovery will take months as the families we serve and all of us return to stability and normalcy. Next slide. I'm pleased to share some of our accomplishment during this last legislative session in our state. This was our first year having a funded state advocacy officer, Olivia Whiteley, which resulted in significant movement in our advocacy efforts to look at policy issues that impact refugees and immigrants in Utah. We worked through education, digital inclusion, food security, language access, and health. Next slide. The first policy priority I'd like to highlight is HCR 22, which is on family engagement. The resolution is titled Celebrating the Contributions of Multilingual and Multicultural Families in Utah. This resolution, of course, celebrates the contributions of multicultural families to promote a more inclusive school environment. And it also encourages not just parental engagement, but family engagement, recognizing the diverse makeup and definition of guardians and other family members and the roles that, that people can take in students' education. We've seen some best practices from the state on creating more welcoming school environments to refugee and immigrant families. And this resolution hopes to, is intended to see that expand so that all schools are adapting these best practices. So this resolution also supports data collection efforts to further invest in these types of models that other schools can adopt. It passed all chambers unanimously, and we had several community members support and testimony, including teachers, refugee students, some are in the photos here, community partners, and more. And the IRC was pleased to take a lead role in this effort by securing sponsors Representative Johnson and Representative Thatcher, drafting the resolutions, working with community partners and other stakeholders, as well as organizing testimony. The second education policy priority that I'd like to highlight is HB 446, and that is addressing multicultural and immigrant student policies, mainly addressing the barriers to enrollment. This seeks to support students who do not have a birth certificate when enrolling, as is often the case with refugees who are fleeing conflict and don't have the ability to capture all of their documents or have been lost in their journey, and allows for other types of documentation to verify a student's age. This bill also requires schools to provide school notices in families' primary languages. Beyond English, that will create more inclusive environments and ensure parents have the adequate information that they need to support their students' education, and requires the Utah State School Board to begin a repository of acceptable transcripts for international immigrant and refugee students to ensure their credits can transfer. So this bill was introduced by Representative Johnson, but unfortunately ran out of time before it could proceed through the legislative process. So we'll be working with Representative Johnson and others in 2022 to keep movements on this bill. And IRC did provide a significant amount of support on this legislation by getting buy-in from a variety of stakeholders, securing the sponsor, and drafting the bill. Next slide. On the digital inclusion front, there are two policy priorities that the IRC supported around digital inclusion. And this was largely built on our lessons learned from the past 5 years of providing digital inclusion programming. And we worked with numerous partners on expanding the digital inclusion efforts in the state. The IRC supported a funding request to the Utah State Board of Education that would create a position and grant funding for digital inclusion efforts in the state. And we also supported efforts with HB 304, Digital Opportunity, which would expand broadband infrastructure, digital access, and digital equity around the state. Unfortunately, this did not pass, but the IRC did offer support via texted take action notices to our supporters, as well as provided testimony. And if you'd like to receive our take action notices on the slide here, you can text rescue to 40649, and it will include you on the text messages when there's legislative action that we're asking our community members to consider contacting elected officials on. You'll receive notices via that way. Next slide. So our other legislative engagement is listed on this slide. We were pleased to offer support to other efforts, including Senate Bill 141 on food security, which creates a food task force and ensures that refugee and immigrants will be represented on that task force. On Senate Bill 214, which increases language access and allows for state translation and interpretation efforts, and supported that via individual emails to selected legislators. Hoping to see more movement on that bill next year for expanded to remove the official language of Utah as English to again promote more inclusive policies. We also supported in sustaining funding to health clinics of Utah, health clinics of Salt Lake City. One of the two clinics that would have been defunded under this reduction in funds is one of the clinics that conducts refugee health screenings. So we were pleased to see that funding retained. And lastly, we coordinated a legislative briefing with our partners at Catholic Community Services and the state refugee offices, which highlighted refugee services in our state. And our goal is to make this an annual briefing to ensure long-term bipartisan support of our services in the state, and to ensure that we can continue our spirit of welcome here in Utah. Next slide. So shifting gears to the national front, as many of you have probably heard, President Biden has approved refugee admissions for next federal fiscal year to 125,000 individuals, as well as broadening the categories of refugees who can be resettled under the presidential determination. We're very excited for this shift and the message that this sends in terms of the United States' responsibility to continue to welcome refugees to our country. And as you can see, the program has always received strong bipartisan support, and the 125,000 person ceiling will take us back to historic numbers in our country. Unfortunately, the revised presidential determination for our current fiscal year that we're in right now has not been signed, and it has resulted in significant delays, resulting in hundreds of canceled cases across the country and here in Utah. The IRC on our national level is working with the Department of State and other policymakers to better understand the delays in setting the ceiling for this current fiscal year. But to date, details on the cause for the delays have not been shared beyond the presidential determination has not been signed. So we're hopeful that we will begin to see movements in the coming months on this. Next slide. So resettlements in Utah, and the last year, we saw our lowest numbers in the state, only welcoming 238 individuals. The majority of cases were resettled by the IRC, the others resettled by Catholic Community Services. Our goal in Utah, between CCS, IRC, and the Refugee Services Office, is to hopefully get back to the 1,200 arrivals that we were welcoming prior to this previous administration. As Utah is nationally recognized for our spirit of welcome and robust programming, we're hopeful that the state of Utah will even increase that 1,200 ceiling to welcome even more refugees in the next 2 to 3 years. And we'll continue to work in close concert with our partners to advocate on behalf of increased arrivals to the state of Utah in the coming months and years. Next slide. While we're looking forward to increased arrivals in the months to come, sadly for this year, we've only resettled 5 individuals from Afghanistan, Iraq, and the Central African Republic. We're anticipating a significant uptick in the last quarter of the year, which is again the federal fiscal year, and that would be over the summer. So as we're working to prepare our staff and office operations to receive increased arrivals, that's the primary focus of our work. And it really does take a village to prepare for new arrivals and offer high quality support that includes cross-team collaboration of several program areas to do so. Several are listed here with our casework, logistic and housing, health and wellness, education, employment, finance and operations, digital inclusion, and so much more. So a couple of our team members that are here today, who you met just a moment ago, are led by Carine Foly, it heads out our resettlement team, and Pamela Silberman, who's leading out on our health and wellness programs. So both today will share a little bit about their program areas with you. And with that, I will turn it over to Carine.
Oh, hi again. Sorry, I was trying to unmute myself. So as I had introduced myself, I'm Carine Foly. I'm the resettlement manager. For those of you that joined later on, I have been with the IRC for about 13 years, and I oversee our housing logistics and casework team. Just to go a little bit over the resettlement team in our office, we currently have 5 caseworkers, 2 casework supervisors, 2 casework assistants, a special needs caseworker, a housing logistic coordinator, and a housing stability AmeriCorps. So as soon as the IRC receives notice regarding the newly arriving family, the whole team, the resettlement team, jumps into actions to prepare to receive that family. So the logistic coordinator will work at ensuring there's an apartment ready for the family, including outfitting the living space, the bedrooms with the needed furniture and essential supplies such as beds, bed sheets, rice cooker, shampoo, and many more supplies. The housing and logistic team is also conducts home visits and workshop with clients, newly arrived clients, so they can navigate through the ins and outs of the housing, U.S. housing and lease agreement. So as far as casework, once the plane lands, there is a caseworker at the airport to welcome families or individual with an interpreter when necessary. Sometimes the families are welcome with family members or friends that are already in Salt Lake City. So they're ready to pick them up and take them to their new home, where families are welcome with a culturally appropriate hot meal. So from there, they start settling pretty much. Every refugee or families that arrive in Salt Lake City through our office gets enrolled automatically into 2 main resettlement programs. The first one is the reception and placement. Sorry, Jesse, I should have said next slides, but thank you. So the first one is the reception and placement program. So with the PRM, the State Department funding, we are able to provide services, variety of RMP services, reception and placement services to our clients. And these services include finding a safe and sanitary housing for our client, assisting the client with social security, cultural orientation, home safety orientation, enrolling clients into social services. There are many more services, but these are the main ones that we provide. And then the second resettlement program that clients are also enrolled into is the extended case management, which we refer to usually as ECM. So that usually happens concurrently or right after the reception and placement services, where clients are able to access services for the next 24 months post-arrival. And that time is very crucial for our clients because we have to ensure that the refugee families are positively integrated into our community. So the focus of the extended case management and then the refugee resettlement is to ensure that refugees become self-sufficient as quickly as possible. And then services that we provide during those 2 years, 24 months, include like regular home visits, need assessment, crisis management or intervention. Assessments are provided in areas of health, employment, personal finances, housing, education. And as I had mentioned, the goal is self-sufficiency, but also to help clients access quickly services offered at the IRC and also in the wider community. Next slide, please. Okay, so as Natalie had mentioned, 62,500 is the updated ceiling for the refugee for fiscal year 2021. And in order for us to get ready for it, we have been putting our efforts on staff hiring and training, increasing capacities and logistic planning, reaching out to partners in our community and service providers to keep them pretty much updated with numbers and all our efforts to be ready for the new arrivals. So pending this, the presidential determination, we have seen some clients being turned away. We've had cases that were scheduled to come for the month of March, for example, but several of them were canceled. Several families here have been affected, and you will be meeting a client, Puneo. Next slide, please. Who is a 25-year-old young man from the DRC, was resettled by IRC last year, June 2019. His family was supposed to follow him right then, but for some reasons they were canceled. And then during this COVID time last year, they were canceled again. They were actually rescheduled to come this year, but because of the pending presidential determination, they were not able to come, so their travel logistics and everything was canceled. We are hoping that once the presidential determination is, the revised presidential determination is signed, families can be reunited again. So, and I will pass it on to Pamela Silberman for the health program overview. Thank you.
Great, thanks, Carine. Hi, everyone. So I have the very good fortune of being the health program manager and overseeing the best team in the office, the health team. And the health team is comprised of these 8, well, soon to be 9, public health professionals who are so committed to ensuring that our clients have access to linguistically and culturally appropriate healthcare. And they coordinate appointments from pretty much the moment clients arrive, health screenings and follow-up specialty care. Many of our clients have not had access to healthcare before arriving in the United States and have untreated medical, physical and emotional health needs. And so this team coordinates their care, ensures that they have interpretation and transportation, and also provides health promotion, education to ensure that ultimately they can do these things on their own, whether it's making appointments, whether it's refilling prescriptions and taking them appropriately, whether it's keeping their children safe and healthy. These are all of the tasks that we, during both the RNP period that Carine spoke of, as well as the extended case management period, we work with our clients to make sure that they have access to healthcare, understand how to navigate the US healthcare system, and then ultimately can do that on their own. Also during this past year, we've added, obviously, the COVID outreach and response has been a huge portion of our time and has impacted all of our work. And so I'll talk a little bit about that. Next slide. So during the past year, in spite of the pandemic, we've still coordinated and supported thousands of appointments. And many of these obviously were appointments that were scheduled, then canceled, then rescheduled due to closures at clinics throughout the year of the pandemic. We have also really focused on providing support for those impacted by COVID. So 155 different households received COVID education and support, and the support included delivery of supplies, hygiene supplies, cleaning supplies, emergency food, the hot meals that Natalie mentioned, as well as working with community leaders to provide education and outreach around COVID, making sure they had masks for their communities, making sure that they had good, accurate information, since there's been so much misinformation around COVID. We also have been part of a project through the Utah Department of Health, Office of Health Disparities. And you can see in the picture, Gate, one of our community health workers, out at a testing site, going out to testing locations to screen individuals who are being tested for their needs, for rental assistance, for food, for information, and then providing that. Also, with clients testing positive, we helped transport dozens of clients to testing locations through using cabs, and making sure that if they tested positive, they understood what that meant and how to quarantine and isolate, and then delivering emergency food that they might need, and then supporting staff as well. We were very fortunate and did not have a lot of positive cases among our staff. We implemented protocols within the office for those that needed to be there very quickly, that we continue to uphold in terms of limiting the number of people coming into the office and making sure people were masking and disinfecting. But we had some positive cases, and we had our COVID navigator to be able to support those staff members, making sure they had the information they needed around quarantining and isolation and when they could return to work. And that's been an incredible help. Next slide. So as every program did, we had to make adaptations. So one of the first adaptations that we made, realizing that we still needed to transport clients to medical appointments in spite of COVID. And so we looked at research on best practices of where people should sit in vehicles, keeping windows open, wearing masks, disinfecting the vehicle, and so that we could transport clients safely, and that staff and clients would both be safe during this time. We also looked at how we are delivering education and information to clients. And what that picture on the right is a screenshot of some of the YouTube videos that we've been able to develop during the past year. So transforming presentations that were normally given in person via PowerPoint into videos with interpretation, with translation overlaid. And one of the things that we realized during this process is that this is a great way to deliver information, because what it does is it puts the information in the hands of the client. So previously, we would have the clients come to the office, they would attend a presentation, and that would be basically their one chance of getting the information because it was a presentation that we held. But by converting this information to videos that we now text links out to clients, we still meet with them via Zoom and go over the information, but the client now has the link and they can watch the video over and over in their own language as many times as they want. And so that's something that we will continue to do. That's an adaptation that we will maintain post-COVID, because what we realize is it puts the information in the hands of the client rather than in the hands of staff. And so you can see, for example, WIC grocery store orientation in Kinyarwanda and Swahili. Learning how to navigate the grocery store and use WIC benefits is very complicated for people who are new to the United States and are not used to the kinds of foods that WIC pays for, are not used to the way that grocery stores are laid out in the United States with the packaged food and needing to read labels and to scan the tags, the UPC codes to make sure that it's an eligible food. And so a client may need to watch this video multiple times until they really feel comfortable going to the grocery store and utilizing their WIC benefits. Likewise, how to schedule a medical appointment, that is very complicated. When you call a doctor's office and you have to press 3 and then press 5 and you don't get a human being, maybe you never get a human being on the phone. Again, how to do that is something that many of us take for granted, but is really complicated for clients who struggle with the language, with literacy. And so again, being able to have a video they can watch multiple times and step by step explain that is an adaptation that I think is really improves our programs, and that thanks to COVID, we were forced to do it, but it's something that really we should be doing, should have been doing all along, and we will continue to do. So looking ahead, what's coming down the pipe for us in 2021? We're really busy, and even without arrivals, at the moment, we're really working hard to prepare for that, as Carine and Natalie mentioned, and make sure that we do our work in really effective ways, especially as we have increased clients. We want to make sure that they have the level of service and attention that they deserve. Obviously, we're working very hard to make sure that clients get vaccinated. We are part of a vaccine messaging project through IRC headquarters with 7 other offices called the National Resource Center for Refugee and Immigrant Communities. And this is funded through the CDC, and developing culturally appropriate messaging that addresses the concerns that refugee and immigrant communities would have around the vaccine in terms of social media, in terms of messaging, video, audio. We're also participating with vaccination clinics. We have currently only had 10 clients vaccinated, but that's mostly because of the eligibility requirements, and most of our clients skew very young. So the 65 and over or 50 and over now hasn't reached a lot of our clients, but we are participating in a clinic on April 5th with the Refugee Services Office and the Department of Health, where we'll be able to have many of our clients vaccinated, and we're reaching out now to those that are interested in being vaccinated. And then we're hoping to host our own clinic in May, where we'll be able to hopefully vaccinate upwards of 150 clients, and really see that as a way to get the vaccine to our clients. For a number of reasons, logistics, but also in terms of clients feeling comfortable with the vaccine, it's easier and more effective for us to host a clinic where clients can come all together and be with IRC staff who they trust and feel comfortable, rather than trying to send them in one by one to be vaccinated at the locations that most of us are going to. And so that's a strategy that we feel is more effective in terms of, again, logistics, but also our clients have a lot of hesitation because rightly so, they come from places where you can't necessarily trust that the vaccination has been tested, that it's safe, that they're not going to receive something that could harm them. And so we're trying to address that vaccine hesitancy. We held a focus group with Swahili speaking clients that provided a lot of insight. We surveyed over 80 clients on telephone asking about their attitudes towards vaccination. And then we're using this information to develop social media messaging and talking points. And we're hoping to start holding some Q&A sessions as well. Outside of COVID, we have a new AmeriCorps member starting in April who will really help us develop robust transportation orientation and training for staff and clients alike, because transportation is one of the biggest barriers that our clients face in terms of accessing healthcare, but also other services in the community. We're working across all our teams to increase digital literacy, particularly in health, getting clients to feel comfortable with using apps like MyChart through the University of Utah so they can check their own medical records. Also, there's a new app that's Utah is one of the first states to roll it out called Docket, where you can actually view your immunization records. So moving away from the old-fashioned yellow card, which people lose, I certainly don't know where mine is, where you can look up your vaccination records on your phone and then download reports that you could use for your school, for your employment. And so that's a really great app that we're going to have our clients start utilizing. And then we have a project to address the social determinants of health. And that's really the environmental, physical, cultural, and societal barriers to health and well-being. And so we'll be working with clients at the 45-day mark to do a health assessment to identify what their health goals and barriers are, and then developing individual client health plans that over the 2 years, what do they want to do in order to achieve health and well-being here in the United States? And what does that mean to them? And then working with their providers to implement those plans and also make appropriate referrals, whether it's a client who wants to grow fresh food and eat healthy, so we would refer them to New Roots, or a client maybe that wants a job that provides insurance benefits. So we would work with the employment program to get a job that maybe has a higher income and comes with insurance benefits, and letting the clients define, being really client-centered and letting clients define what health and well-being is for them. And then finally, we have 2 new projects that we're really excited to roll out. One is a family level well-being. So we've done a lot of psychosocial support for adults and individuals, but now we'll be able to look at the family level and really look at what does mental health mean for parents and children together, and doing psychosocial support and some parent engagement. And then we have a men's engagement project that we've finalized the curriculum for, and we'll start recruiting men to become allies in preventing violence against women. And obviously, we know that's incredibly important because a lot of violence prevention efforts, or I wouldn't say prevention, but violence against women efforts have been focused on survivor support, which obviously we continue to screen our clients and support them if they are survivors of domestic and gender-based violence. But we really want to look at engaging men in the prevention efforts. And so that's a project that will be rolling out this spring to start with groups of men to have these conversations about how they can become allies in the prevention of violence. So it's a busy year for us, and we're really excited about all of the different projects that we have going on, and that we can provide really holistic approaches to health and well-being for our clients and work across our programs to improve the quality of life for our clients. So thank you so much for listening.
Great. Thank you, Pam, Natalie, and Carine. We will now move into the Q&A portion of the conversation today. So I'm just going to stop sharing my screen so we can see each other again. And then let me just queue up some of the questions. So we did receive a few questions from folks ahead of time, but we'd like to go ahead and address now. We do have about 20 minutes remaining in the call today. We'll take a look at the chat, and there should be plenty of time to get at any questions that you have for us. So I think we'll jump right in. I think one of the first questions, and kind of still very relevant, and maybe Natalie, you can kick us off with an answer, but what is the biggest impact the pandemic has made on the families we serve?
Thanks for that question. I think it's obviously an important one. I would say the impact is similar to what we've seen to other vulnerable community members in terms of housing. Of course, I highlighted the increased requested housing assistance that we've had over the past year. Job loss or reduced hours, which have impact families' livelihoods in numerous ways, educational barriers to access and connecting with educators and their schools directly. I would be remiss if I didn't share that we've experienced our own difficulties in connecting with clients in a way that is very different from what we're used to doing. And, you know, our office is hustling and bustling for many of you that have visited it. And we definitely have experienced challenges in staying connected, especially to all of our clients. But we've done quite a bit to reduce those barriers overall. I would say an additional specific to the community that we serve is the misinformation on COVID and on the vaccine, which Pam highlighted some ways that we're trying to overcome those barriers. And then increased isolation. Navigating a new community is difficult regardless, but doing it in a space where people are masked, where you can't gather in large groups, that you can't just pop into the office and ask for support on a variety of issues. And a lot of times our clients like to be at the office. They like to hang out and to see and talk to all of the different staff members that are there. And it's part of, you know, becoming integrated into community and understanding the resources and people that are there to offer support. And so that increased isolation has definitely been, I think, a unique impact to the individuals that we serve. Pam or Carine, do you have anything else to add?
I think to build on that, there was a question I saw in the chat about how refugee communities, sort of data on refugees contracting COVID. And I would say that, you know, refugees, well, communities of color across the country, and Utah is no different, have been disproportionately impacted by COVID. And refugees are from, you know, Africa, Asia. They are communities of color themselves. And so we've seen that because our clients work in the kinds of jobs where they couldn't work from home, and so were impacted through their work. They were also in the kinds of jobs where they were let go without benefits and without a safety net. So we saw financial impacts. Also, our clients live in the neighborhoods that were disproportionately impacted. If we looked at zip code distribution, in Salt Lake, particularly the 84104 neighborhoods on the west side, 84116, very high rates, as well as down like in Midvale, we've seen a lot of cases. Our clients live in small homes with few bathrooms, and so quarantining and isolation was particularly challenging for them. And so we have seen a spike of refugee cases, especially in the summer. We had a lot of cases, certain complexes where clients are gathering and congregating and didn't necessarily have the resources to go out and buy all kinds of designer masks like the rest of us did. So we did a good effort of trying to distribute masks and teach clients how to wear them correctly. So as of now, we see very few cases, and we're focused on vaccine outreach. And as I mentioned, there's some real challenges with that, with misinformation. But one really hopeful thing that we've seen is that when we did hold the focus group, one of the messages that clients said is that we're confused. We don't know who to listen to. We hear a lot of information, but we trust the IRC. We want you to tell us what's correct. And so our clients do trust us. They do know that we want to provide them with good information. And so that is something that we will continue to do and try to reach out to them to make sure that they feel confident and comfortable, and that we are a trusted source for them.
Great, thanks, Natalie and Pam. Carine, did you have something you'd like to add?
Yeah, I just wanted to add on regarding digital literacy. I think that is still one of the challenges that clients face. Um, and as also, so when I mentioned digital literacy, some during the COVID time when it was really intense, kids were sent home, and some were sent home with tablets or a laptop, but parents or even the children did not know how to navigate, connect to the classroom, or so that was a huge, it was a big challenge for the client. I We have also noticed that some schools were going in person, and then the week there's a positive case and they have to be sent home, then the parents are stuck with childcare. They're not sure, they can't leave their kids alone. It was so uncertain. It was a little hard for families to navigate through um, childcare and then the school and the work schedule. So
Great, thanks,
thank you.
Carine. I think the next question also touches on this a little bit, and this is another we received ahead of time, but how has the pandemic affected refugees in college and other school-aged youth? So maybe Natalie, if you want to start, and then Carine, if you have other thoughts to add.
Yeah, I think we've kind of touched on some of the challenges that we've seen around digital barriers. And I know I have several students who were in college who decided to stay home this year, or to take the semester or full academic year off of college, or to transition to the community college. So again, kind of reflecting what we've seen on national trends, looking at first generation students and marginalized community members who already experience significant barriers to entry into college and challenges with their education. Those same kind of scenarios presented themselves with refugee students. I will say part of the reason that we selected the policy priorities that we did around education and digital inclusion is because of what we've seen over the last year. The families who were connected with their schools or had built trusted relationships with educators, they received more support, to educators who were checking in on students, offering targeted assistance. The families who didn't have that type of connection, the IRC is a broker, kind of a bridge for those connections, but it's particularly salient in newer arrivals. And so again, that's why we want to make sure that family engagement is prioritized within schools, and creating welcoming environments there, and that we're able to address those digital barriers that exist that take time to overcome. But a lot of it is consistent access to internet, broadband internet that is high speed enough to get multiple family members online if they need to be. When people have adequate hardware to purchase computers or even headphones, there were teachers who would reach out to us and say, I'm noticing that these students don't have headphones and there's a lot of background noise happening all the time. Is there any way that we could get this household some headsets? Yes, we're on it. We will do that. So just that communication is really important in what we've seen. but again, a lot of the impacts that we've seen are reflective of things that we've seen in broader community members as well. But compound that with being new to a country and having language, limited English access or English ability, and those impacts are magnified. Yeah, did anybody else want to add anything?
Great. This is somewhat related to seeing the question in the chat, and we don't necessarily have the education program manager or college and career readiness program specialist on today. But Natalie, if you had thoughts on a quick update on college and career readiness and mentoring programming and what's been happening there.
Yeah, we're actually kind of ramping up our college and career readiness programming as we speak. We received a grant from the Cotopaxi Foundation, where we'll be able to do some kind of peer-to-peer mentorship. So having older refugee students mentor younger refugee students, and especially those who have navigated educational pathways, and then providing some professional internship opportunities, and kind of meeting students where they're at through a 3-tiered approach. I think for one of our next town halls, we would love to have our education program, share a little bit more about what that programming looks like. And so we're starting to revamp and revisit some of the those other programming efforts that we've seen before. I will say we also were focused on digital tutoring opportunities. So we had several volunteers who continue to tutor students through one-on-one kind of Zoom communication, and then that's moderated and supported by staff members, just to, for quality control and making sure that things are that the appropriate type of support is provided. And so we're continuing to do that. And I would say that that's going to be critically important as we move forward into recovery. We know that a lot of students have been left behind. We know that there's going to be a lot of catch up to do. We know that there's going to be a significant amount of support that's needed there. So we're going to continue to deepen our efforts in that program area.
Great, thank you, Natalie. I think shifting gears ever so slightly, and just we have about 9 minutes left, so if you have questions, burning questions, please feel free to submit those to the chat and we can work to address them. But just a couple others that were submitted ahead of time. Again, shifting gears, but something somewhat specific, and Pam, maybe you can take this one on. This is specific to dental health providers, but how can health providers support refugee community members?
So around dental, I mean, that's a great question. So Medicaid doesn't pay for adult dental care except for emergency extraction. So dental care is one of the biggest gaps in health that our refugee adults have. We have an excellent partnership with the University of Utah School of Dentistry, where they provide comprehensive dental services for all of our clients. However, especially with increased arrivals expected, their capacity may be really stretched. And what we've seen is in other, when other dental clinics or providers want to work with refugees, generally speaking, they want to just do screenings and maybe cleanings. But unfortunately, that's really not what our clients need. Our clients have come with a lifetime with no dental care access. And so we see a lot of need for periodontal work, a lot of cavities. And so, I think in terms of dental care, if there are other clinics, providers that are interested in providing comprehensive dental services to refugees for free, because like I said, the Medicaid does not cover these services, so it really is donated services. That's something that's a great need, because that's one of the biggest gaps that we see. As far as other health services, fortunately, because of Medicaid expansion in Utah, we see many more of our clients covered. Previously, a lot of clients lost their Medicaid coverage after 8 months if they were single or didn't have children. But we're really pleased that the vast majority of our clients are able to continue their Medicaid coverage until they find jobs that provide insurance or they're able to afford to buy into the marketplace. We still have clients that do fall into the Medicaid coverage gap, but luckily it's a lot fewer than previously. And so that's been a huge benefit of Medicaid expansion for our population.
Great, thank you, Pam. I think one of the last questions, and this definitely gets to Bonnie, your question, though I think, Bonnie, I can also follow up with you more specifically about our family mentor programming and how that might look in the coming months and years. We are working on kind of revamping Family Mentor and making sure that it's applicable to where we're currently at. But I think, Natalie, if you want to talk a little bit more broadly, ways that the community can engage and lend a helping hand. There was a specific question about how schools can get involved in that process as well, but I think it would also be good just kind of speak broadly to that question.
Sure, I'd be happy to. For schools, again, we're really heavily focused on this family engagement piece, so identifying ways that we can support families that we're serving to engage more fully in the schools that you are working with. is one area. And of course, ramping up those tutoring programs, whether it's virtual or in person, as we move into the next phase of our COVID recovery, would be critically important. And however we can ensure that our students are getting enrolled is helpful, or if there's ways for partnership in that, we would be happy to explore that. In terms of broader community support, we touched on or highlighted our resettlement ramp-up efforts. You know, we're going to see a significant number of increased arrivals in the next year and further years to come. And so community members can organize an in-kind donation drive. We have a variety of kits and different things that are available for civic groups or faith groups or neighborhood groups, whatever it is, to organize a in-kind donation drive. For volunteers who are interested, who are vaccinated or comfortable doing in-person support, we're going to be ready to open up those opportunities again. You know, we're just starting off with some office, you know, reception work or front desk assistance, a variety of different things like that. But of course, more community-based volunteering efforts will be opening up, and I believe we put the link to the volunteer opportunities in the chat there. And then, of course, financial support is always needed with our work, particularly as it relates to some of these newer program initiatives or that are a little bit more difficult to secure funding for because they are new. We're testing out some different models and working through some pilot phases with the programs that we're running. And so unrestricted funding allows for us to be able to allocate those funds to those program areas or operating needs that we see. So yes, financial support is always appreciated. I saw one question in the chat around donors who fall into the Medicaid gap. We don't have a specific kind of funding category for that, but certainly we could explore if there is interest there as well.
Great, thank you, Natalie. I did want to point out too, for volunteer opportunities, we are currently recruiting for a housing support volunteer. Requires daytime availability, but to really help us increase the number of people who are working on apartment setups. We've had incredible community support over the last 20 years from the First Unitarian Church and the Refugee Resettlement Committee there. And we're looking to kind of expand on their efforts and increase the pool of volunteers who are supporting. So that's another volunteer opportunity that if you yourself have time, if you know of people who have time, we're looking to expand that pool of volunteers. I think we have about 1 minute left. If there are any last questions. Yeah, Joe?
Jesse, how are the digital needs being met? Are the new families, arrivals getting computers? Are they getting electronic help in terms of being connected? Are the kids getting headphones or things that they need for this kind of thing? Or do you have a program specifically for that or funding available?
Yeah, so I think there are a couple of fronts there. I will say devices and other headphones and things like that we're always looking for additional resources to cover those needs. We do currently have a few areas and partners who are providing devices specifically, and we have those covered over the coming months. But after that, and as arrivals increase, just ensuring that at least one laptop gets into every home will be kind of a community effort and working on finding new pathways for additional devices, whether they're new or refurbished to come in. So I think those are things that we're always looking to explore and can utilize additional resources there, whether it's the in-kind donation or funding to help us find kind of bulk rates to then make purchases for those specifically. I will say we are also in partnership with Comcast through their Internet Essentials programming, and the IRC is helping to cover the first few months of internet access for refugee families, so that the connection is not an issue or a barrier upon arrival. And that's something that we've identified, especially over the last year, that being able to pay for the rates of internet is a barrier for families, and the IRC is stepping in to provide that access. And so that is another way that unrestricted funding is supporting families directly, is with their internet access upon arrival.
And I would just also say that the other barrier, it's not just the hardware and the software, but really learning to use these different technologies. And that's, we have tech mentors, and I think expanding that and really trying to address those challenges, because we do everything online these days, whether it's paying our bills, checking our medical records, checking our children's school records, and the digital divide is just growing because it's not enough to give people the hardware and the software. They have to have the skills to do these, to navigate these various apps and websites and programs that are difficult for many of us to figure out at times, and rely on knowledge of English and literacy in English, which many of our clients lack. And so I think that's the other complexity that we face, is you can't just hand somebody a device and make sure they have internet. It's really, they need support in learning how to navigate these apps and feel comfortable using them.
Great, thanks, Pam. And it is 1 minute after 1 o'clock, so I think we will stop there. If you have any other questions, please feel free to reach out. You have my email address, and I will be following up with a link to the recording, and you can ask questions then. We're really grateful for your continued support, for your efforts to welcome refugees to our community, and for joining in the conversation today. I look forward to following up in the coming days with that link and with other information. But for now, be well and stay safe, everyone. And again, thank you so much for joining us.